Good morning, everyone. My name is Peggy. Today, I want to talk about the journal article analysis entitled Physical Exercise Ameliorates Anxiety, Depression, and Sleeping Quality. Experimental evidence from exercise intensity and exercise frequency. Anxiety among college students is getting more and more serious as they might have pressure such as academic pressure and employment pressure because college students might be excessive worried about their results and their future. Hence, the researcher intends to study on how exercise could affect on anxiety, depression, and sleep quality. There's a survey finding that the escalation of anxiety symptoms among college students in China is relatively large. It is about 18.2% of college students suffer from anxiety symptoms. Most of them are having mild symptoms. They might trigger with mood swings and suicidal thoughts. Thus, anxiety and depression may cause students' academic performance become worse and worse. Therefore, they conducted a study on how exercise could affect the improvement of anxiety, depression, and sleep quality among college students. Exercise intensity and exercise frequency have different effects on anxiety, depression, and sleep quality improvement. The topic of this research was clearly explained. High level of distress is certainly unhealthy for university students, emotionally and academically. Hence, the initiative to identify the best solution to solve a problem is necessary. In conclusion, the vision and significance of this research was comprehensively projected in the introduction. Exercise intensity could affect one's anxiety symptoms. Stress is an important and a major factor which may cause anxiety. A study revealed that there was among 90.8% of college students reported stress because of extensive workloads. Analysts have attested that the improvement of anxiety symptoms on the patients after exercising is higher than his or her anxiety symptoms before training. Prior papers have also found that exercise might not only improve anxiety symptoms among college students, it also improves academic performance by improving concentration or attention during class or revision. Exercise intensity could affect one's depression symptoms. Stress occurs when there are academic expectations from their parents and teachers or even themselves, then causing depression. Past analysis shown that the improvement of depression symptoms for post-exercise was significantly much better than pre-exercise. After exercising, mood and emotions will be improved as exercise stimulates endorphins, which may help someone to be happier. This is not only decrease the feeling of depression, it also reduces the pressure and depression symptoms as hormones and brain chemicals could regulate and lift our mood. Exercise intensity could affect one's sleep quality. College students who suffered with anxiety or depression disorder because of stress might often come with sleeping disorder like insomnia too. Study found that sleeping quality improvement after doing exercise was significantly higher and greater than that without doing exercise. Exercise could help us to have better sleeping quality at night, sleeps longer, taking less time to sleep, and waking less at night. Exercise improves sleep, while sleep improves brain function, especially improving memory, which could help in improving academic performance. The participants are all the college students ranged in the age from 19 to 29 years old, including undergraduate students, master and doctorate students. They were participating in this study, which done by College Student Health Guidance Center. Only students who used anti-anxiety medication with physical illness or with mental illness diseases were excluded. Screening according to Diagnostic and Statistical Manual of Mental Disorders, anxiety diagnostic principles was carried out. Students who did not reach the criteria will be dropped out halfway. The study starts with 132 students. After screening, 23 students were excluded. The remaining students were divided into 6 groups randomly. They were given with 6 weeks exercise intervention to observe the effects on anxiety, depression, and sleep quality with different combinations of exercise intensity and frequency. After that, 25 students were excluded. 84 students, 51 males and 33 females were included in this final analysis. They used 3 methods to measure. Firstly, they used the Beck Anxiety Inventory to measure the anxiety symptoms among the students. Then they used self-rating depression scale to measure the depression symptoms among the students. Lastly, they used Pittsburgh Sleep Quality Index to measure whether the students having sleeping disorder. The findings revealed that exercise is an efficient way of improving anxiety, depression, and sleeping quality, showing the effects of exercise intensity and exercise frequency on anxiety, depression, and sleeping quality among college students. Findings were logical and were illustrated clearly in visual and words. Academic and unemployment may be the factors which influence the level of stress among the students. However, the evidences have successfully and clearly proved that exercise could reduce anxiety and depression and improve sleep quality. The limitation is they are all using the self-assessment methods, which may lead to biases in the measuring results. The measuring results may be influenced by the subjective emotions when they are filling out the questionnaire. This study contributes to measuring tools to measure the symptoms, and then they study the effects of different combinations of exercise intensity and exercise frequency on anxiety, depression, and sleep quality of college students. The author did not make any recommendations. Experiment above showed that exercise could improve sleep quality and decrease symptoms of anxiety and depression among college students. Furthermore, they found that exercise intensity and exercise frequency have different effects and impacts on anxiety, depression, and sleep quality. Which exercise frequency will have an impact on anxiety and depression but limit impact on sleep quality, while the effect of exercise intensity on anxiety and depression was higher than that of exercise frequency. In this study, we examined that the effects of physical exercise on anxiety, depression, and sleep quality in college students. As my current research focuses on the effects of exercise intensity and exercise frequency on anxiety, depression, and sleeping quality, this article had provided a brief idea on exercise which could improve sleeping quality for elderly. For example, moderate intensity aerobic exercise 3 times a week can significantly improve the sleep quality of the elderly. But there is still lack of research, and many studies are needed to prove whether it brings improvement on anxiety, depression, or sleep. Therefore, this journal article will be included in my research paper for the further discussions. Thank you.